Pain Rehabilitation Center option was presented to me, and the route I was going was not working for me, so I wanted to look at another avenue, and it was the right choice for me, and I went ahead and went forward with it. Heading into the PRC, I was struggling daily, and my functionality level was about a 3 on a scale of 1 to 10. After going through the program and then continuing the things I learned, I'm operating, I would say, a 8 out of 10, and I've been able to resume a lot of the functions that I had previously lost. Really, it was day-to-day activities, everything from continuing on in sports to being able to get up and do all the things with my kids. And granted, the level of sports is not the same, but I'm able to continue to stay active. And obviously, one of the big stress points of PRC was continuing to stay active, but looking at things in moderation. And I've followed it to a T, really, and that's where I'm at, and I'm able to enjoy the activities, just not maybe at the same level as when I was 20. What some of the challenges during the program? That's a pretty long list, really. A couple of the things that not only I face, but most people in the program is accepting a new way to look at things and getting out of the traditional role of doctor medicine patient relationship. We were forced to examine some things with ourselves that had yet to be faced, and a lot of times getting into that depth is challenging mentally. On the physical side, it was a very similar approach. We had to kind of start over, and so a lot of the activities were so basic in a sense that it's tough to take yourself all the way back, but the thing that was drilled into us was moderation, moderation, and activity, and kind of true to word. That's how it played out, and that's what helped to stay active, and but also to bring it down a notch or two. Yeah, some of the challenges after graduation were maintaining a lot of the things we learned as I was introduced back to real life. Real life did not slow down, so we really had to focus on the techniques that we were taught to make sure we could continue with real life, but also continue with what we learned at the PRC. In general, um, just made it fit because I had to. Didn't have an option and didn't want to go back to the way I was. Specifically, I travel for a living in a car, and something as simple as one of the techniques we learned to the 90 minute, 90 mile rule, to get out, stop, smell the roses, exercise, get your body moving. Sticking to little things like that is really, I mean, it was numerous things like that, but that one in particular seems so little, but it was actually a very big part of the ongoing recovery. It's kind of all encompassing, really. It's not you can do this and not this. So it was something from each phase of the program. So throughout the program, they addressed sleep, they addressed stress, they addressed exercise, they addressed activity, and it was bits and pieces from each of those and how they all contribute to the overall well-being and improvement. And really, I mean, the if I had to single one thing out, it was activity and the sleep cycles, and improving those and improving my sleeping habits that have allowed me to continue to progress. Solid. My life has improved. I don't know how to rate it, but just feeling better brings all kinds of happiness to my own life, to what I bring to my wife, and how I'm able to bring the energy and life to my kids as well. It's just improved dramatically. And I don't know if this is the right point of this question, but so 17 months, and I have yet to be to a doctor. Not one time. My family and friends were a big part of the overall process. Initially, my job gave me the opportunity to go. My family gave me the opportunity to go. And so they were very supportive on the front end. During, there's a lot of exploration and development yourself, so a lot of it is on the individual. Uh, but I knew I had that support when I needed it. And upon my return, they were as big a part of the process. They attended a graduation and how the family can participate in the process as well. So my wife was fully on board and brought a lot of the techniques that she learned to help support me back. And our community is amazing too. And she brought a lot of our close friends. My wife brought a lot of our close friends up to speed on how their participation could help in my progress as well. Absolutely. My social circles have changed for the better. Um, a lot of people that are introduced to this program are at a point, and I can speak for myself on this, but where our social interaction had changed to the detriment because of the constant or the chronic situation I was in, and just being free and being more active and a healthier lifestyle has allowed me to rejoin some of the social circles. It's allowed me to be really more who I am and getting a second chance at life, and through social circles, through work circles, and reestablishing some friendships that had dissipated over the years. The opportunities the PRC has allowed me, and really, if we can put it in a one statement, it's given me a second chance at a life that I didn't have before. Um, that's as simplistically as I can put it. It's given me an opportunity to see what life is like again. No medication, no doctors, and feeling great. For any of those that are considering attending the Rehabilitation Center and program, I, the advice I would give you is just what I did myself, and this is what worked for me. The first thing is I was kind of out of options. I'd run through the course, and most people run through the typical course. Most people that get to this point have also done the same thing, and I wanted a new approach and a new way to look at it. The second thing, when I went in, I went with no preconceived notion. I didn't even read the agenda, and it wasn't because I didn't care. It was because I was fully committed to doing what this program was providing. So every day I wanted to show up and do the best I could given that moment. And Dr. Snetton, I fully committed to him. I believed in him, and I trusted what he was putting out there was what would work for me, and it proved to be true. Very thankful of the PRC staff and program. It's changed my life for the better, and I fully understand each situation is different. But for me personally, it has allowed me to be doctor-free, medication-free, and really happy for the past 17 months. So I would recommend it to any of my friends or anybody in a similar situation. For those that are tired of taking medication, tired of doctor visits, tired of missing work, tired of being tired, really, this could be the answer for you. And it certainly was for me, and I'm forever grateful for the opportunity and being introduced to the program. The advice I would give to the patients currently enrolled in the program is to stick with the program. You almost don't realize the progress you're making when you're in the middle of it. But throughout the process, there's ups and downs. But overall, if you stick with it and continue to take on the advice that's provided, the finish line and the end is a whole new you. But also, if I given a moment, I would like to just say what the staff means to me to this day, what the program means to me to this day, how it has really changed my life for the better. And I would recommend it to anybody I came across, anybody that is tired of the current situation, anyone that is tired of taking medicine, tired of taking days off to go see the doctor. And I understand each situation is different, but for me, I am doctor-free, medication-free, and I thank the PRC staff and program for that.